What's that? Who there? Whoa.
So, one thing that I love talking to founders about is the way they analyze an opportunity space, and then what are the triggers or the light bulb moments from that analysis that say, like, I got to be in this space. For you, obviously, you had a personal connection to needing alternative treatment for this, which makes sense. But from a business perspective, when you looked at psychedelics, it's kind of like the Wild West from my perspective, right? There's a lot of open space. So how did you analyze that? And kind of what were some of the things that got you really excited as you were taking the first initial steps for Mindbloom?
There's a few different directions we can go in here. I mean, one is I've been thinking for over 11 years now that from my personal experiences, that the truth was that these medicines were deeply powerful, right? And hopefully the truth would get out there and this would be something that society came around to and was helping people access. Probably about 5 years after I had started using these medicines for myself, I started to learn that there was a therapeutic and clinical paradigm and tons of research. So in my viewpoint, like I discovered this thing I thought on my own and thought I had this secret, but it was already out there. So this was something I've been following really closely for a long time and was already like the change I most wanted to see in the world. From there, I started to see a lot of the cultural tailwinds blowing. So, Tim Ferriss having like the courage to put his reputation on the line to talk about and promote the research, following along with the Multidisciplinary Association of Psychedelic Studies, MAPS, and the amazing progress that they were making on MDMA assisted therapy clinical trials and bringing these to market. And then starting to see even like Michael Pollan and Joe Rogan and other both sort of academic and scientific and like cultural influencers, for lack of a better word, promoting this. The tipping point for me was that I left Mighty. I wanted to do something in mental health care. I have a lot of friends who built really big telemedicine companies that are increasing access to treatment. I wanted to do it in an area that was deeply personal to me. And I was getting lunch with my personalized medicine physician in Manhattan. I was telling him how I wanted to do mental health care, but the thing that I thought was most exciting, where the future was already here, it's just not evenly distributed, was psychedelic medicine, but maybe we're a year or two too early. He blew my mind when he told me that he was prescribing ketamine therapy in his practice, and it was this growing sort of cottage industry of ketamine therapy providers with more and more research every day behind it and more clinical and patient outcomes. So I became a patient myself, and clear as day, I saw, wow, if we can increase access to this treatment and make it available to more people and build an incredible experience around it, we could really transform a lot of lives and really accelerate the healthcare system's adoption of these therapies.
Yeah. And so ketamine was the starting point because it's the only FDA legalized psychedelic today, right? I mean, there's been some legislation passed very recently that with mushrooms, but is that why you started with ketamine?
Yeah, I mean, ketamine is the only prescribable psychedelic therapy. So options in psychedelics right now are to do like to essentially to be like a biotech or pharma company bringing a medicine to market through clinical trials. Clinical trials usually take 13 years and $2.5 billion. So that's not the sort of tech entrepreneur I am, but I applaud and cheering like crazy the people who are bringing these medicines to market. Other options are maybe to create an ancillary product like a education or content site. So a platform I really like for anyone interested in psychedelics is Third Wave, the thirdwave.co. They have a lot of podcasts and content around psychedelics. And then the third option is actually like care delivery. And so as a both consumer and B2B software entrepreneur, that was the area that I thought I could apply my potential talents, which is building a consumer platform around this.